When we talk about neglect, we're referring to situations where basic needs are not being met, such as adequate nutrition, safe shelter, proper education, supervision, or medical care. These omissions might seem simple, but they can have serious consequences on a child's well-being. There are different types of neglect to be aware of. For instance, dental neglect might lead to serious health issues, emotional neglect can affect a child's sense of security, and medical neglect can worsen health conditions. Physical neglect involves failing to provide necessary physical needs, while supervisory neglect refers to not adequately overseeing a child's safety. The impact of neglect can be profound. Children who experience neglect often face growth delays and developmental issues, which can affect their physical and cognitive development. Behavioral problems and attachment difficulties are also common, making it harder for them to form healthy relationships later in life. Recognizing these signs is crucial because neglect, despite sometimes being less obvious than other forms of maltreatment, can have lifelong effects. This ties directly into our overall goal of understanding and preventing all forms of child abuse to promote healthier, safer environments for children. Let's talk about the healthcare response to neglect. First, medical interventions are crucial. This means treating any physical health problems the child might have and simplifying plans for managing chronic conditions, so they are easier for families to follow. Developmental assessments are also important to identify any delays early on. Plus, referring children to mental health professionals when needed helps address emotional or psychological issues that might be linked to neglect. On the prevention side, screening for parental depression is key because a parent's mental health directly impacts their ability to care for their child. Providing anticipatory guidance on supervision helps caregivers understand how to keep children safe as they grow and develop. Injury prevention education is another vital component, teaching families how to prevent accidents before they happen. Lastly, connecting families with community resources ensures they have access to the support and services they need to promote healthier environments for children. All of these strategies work together to address neglect comprehensively, emphasizing the importance of a proactive, multifaceted approach. When it comes to recognizing physical abuse, there are some key patterns to look out for. Let's start with bruising. Red flags include bruises that have a patterned appearance, which might indicate something like an object used to inflict harm. Also, bruises located in unusual places, such as the torso, ears, or neck, should raise concern, especially if they appear in infants who aren't yet mobile. Moving on to burns, approximately 10% of children hospitalized for burns are actually victims of abuse. These burns often have clear demarcation lines, meaning the edges are sharply defined, and they tend to be uniform in depth. Sometimes, you'll see distinctive patterns, like glove or stocking shapes, that suggest intentional harm rather than accidental injury. Finally, fractures can be particularly telling. When multiple bones are fractured, especially in young children, it's a red flag. Fractures of the ribs, metaphyseal areas near the growth plates, or scapular fractures are highly specific indicators of abuse. Recognizing these patterns is crucial in our overall effort to protect vulnerable children and ensure timely intervention. Abusive head trauma is actually the leading cause of death from physical abuse in children. It mostly affects infants, who are particularly vulnerable. Often, the trigger is the caregiver's inability to tolerate the baby crying, which unfortunately can lead to dangerous responses. The primary mechanism involved is shaking the child or causing blunt impact trauma. These are the main ways this injury occurs. When it comes to how it presents, the signs can range from subtle to very severe. Some children may appear irritable or lethargic, and others might have vomiting, seizures, or even slip into a coma. A critical point to remember is that a subdural hemorrhage is a common injury associated with this trauma. It's important to note that about 1/3 of cases are initially misdiagnosed, which highlights how tricky these cases can be. Additionally, more than 25% of children are re-injured before the correct diagnosis is made. This underscores the importance of awareness and vigilance in identifying these injuries early to prevent further harm. Let's take a closer look at abdominal trauma, which is actually the second leading cause of death in trauma cases. Despite its high mortality rate, it can often be tricky to identify because there may be little to no external bruising or visible signs. This is especially true with blunt trauma to the abdomen, and it's important to note that infants and toddlers are particularly vulnerable due to their smaller size and less developed protective muscles. When we talk about common injuries from abdominal trauma, liver damage is one of the most frequent. The liver's blood supply makes bleeding into the abdomen a serious concern. Pancreatic injuries, although less common, can be very serious due to the pancreas's location and the difficulty in detecting injury early. Hollow viscous injuries, involving the stomach, intestines, or other hollow organs, are also critical because they can lead to infection or peritonitis if not promptly diagnosed. Diagnosing these injuries can be quite challenging. Often, there are minimal external signs, which means a patient might not appear severely injured at first glance. Inaccurate or incomplete history taking can delay diagnosis significantly. That's why imaging, particularly a CT scan, is considered the imaging modality of choice. It provides detailed insights into internal injuries that might not be obvious externally. Overall, understanding these key points helps us appreciate the importance of vigilance and thorough assessment in cases of abdominal trauma, especially since early diagnosis can be life-saving. Let's talk about medical child abuse, specifically fabrication and induction. This involves unnecessary and often harmful medical care that is instigated by a caregiver. It can manifest through patterns of exaggeration, fabrication of symptoms, or even inducing symptoms in the child. One of the key red flags to watch for is when symptoms are only observed by one caregiver. If objective findings, like lab results or physical exams, don't match the reported symptoms, that's a major warning sign. When evaluating these cases, it's important to review medical records across different settings. This helps us spot patterns of misreporting or unnecessary testing that might suggest abuse. Finally, collaboration among providers is crucial. We need to work together to de-escalate any unnecessary care and ensure the child is protected from harm. Recognizing these patterns and acting accordingly can make a significant difference in safeguarding children. Let's talk about sexual abuse and exploitation. This involves situations where a child is involved in sexual activities that they simply cannot understand or give informed consent to. Most often, the perpetrators are people the child knows well, which makes the situation even more complex. These cases can also be chronic, meaning the abuse happens repeatedly over time. When it comes to recognizing these situations, children might disclose abuse to a trusted adult, or we might notice concerning sexual behaviors during our assessments. Sometimes, we discover issues like sexually transmitted infections that raise red flags. In terms of evaluation, it's important to ask open-ended questions to understand what the child has experienced, and a complete physical exam is essential. Interestingly, most children will have normal genital findings, so we need to rely on other signs and disclosures as well. Now, I want to highlight the importance of being alert to commercial sexual exploitation, or CSEC. This includes trafficking and pornography. Indicators can include things like tattoos that may be branding or signs of control, multiple STIs, or an adult who seems unrelated to the child and is always present. Recognizing these signs is crucial for protecting vulnerable children and intervening early. Connecting this to our overall theme, understanding these key points helps us better identify, evaluate, and support children who may be victims of sexual abuse and exploitation. Now, let's talk about management and prevention. As physicians, we're mandated reporters, which means we have a legal and ethical obligation to act if we suspect abuse. This involves thorough medical documentation, providing trauma-informed care to support the patient's emotional and physical well-being, and engaging in prevention programs that can really save lives. First, in the immediate response, our priority is to treat any injuries the child has sustained, carefully document all findings, and report our concerns to Child Protective Services or the police. This step is crucial for ensuring the child's safety right away. Next, for clinical management, trauma-focused cognitive behavioral therapy is a highly effective approach. It helps children process their experiences and build resilience. Additionally, raising awareness about the long-term health impacts of abuse encourages ongoing support and intervention. Prevention is equally important. Educating caregivers about abusive head trauma, implementing home nursing programs, and conducting psychosocial screenings can all help identify at-risk families early and provide the necessary support. Finally, advocacy plays a vital role. Strengthening families through community resources, supporting prevention efforts at a broader level, and protecting our most vulnerable patients are essential parts of our role as healthcare providers. All of these elements together form a comprehensive approach to safeguarding children and promoting healthier, safer communities.